Since Wednesday, April the 1st, we have seen a 42% increase in confirmed COVID-19 cases here in Baltimore City. The data that I will provide is official data that we get from the state. As of this morning, the city has 313 reported cases, 145 people hospitalized with COVID-19, and 4 deaths. This number includes 5 cases related to the Future Care facility. We are committed to scaling up our resources to this emergency, leveraging the wealth of medical and public health expertise here in Baltimore City. I'm very excited to announce a new public-private partnership between the Baltimore City government and some of our leading local health institutions, Care First, the University of Maryland Medical System, and Johns Hopkins Medicine and the Bloomberg School of Public Health. This partnership will help us expand our joint efforts to respond to COVID-19. We are already rapidly scaling up efforts to build our capacity to serve city residents. In the coming days, we will launch several new resources, including online tools to help you understand your risks, assess your symptoms, and find information. Expanding call center capacity to respond to COVID-19 concerns and connect you to health resources. Guidance on self-isolation, quarantine, social distancing, and other important steps to help control this disease. And detailed plans and resources to support vulnerable population, including individuals who are experiencing homelessness or are living in long-term care facilities. We will provide our next update on our joint work on Tuesday, April the 7th. Today I'm joined by our partners, and we have University of Maryland Medical System CEO and President Dr. Mohan Santa, Johns Hopkins Health System President Kevin Sowers, and Care First CEO and President Bryan, I don't want to mess up your name, I'll say Pennock. And now I will ask each of them to come up and share a few remarks. Dr. Santa, you will speak first, then you introduce Kevin Sowers, and then he will introduce Bryan, in that order.
So good afternoon. On behalf of the University of Maryland Medical System, we look forward to this very unique partnership as we address what is described appropriately as an unprecedented healthcare challenge to our communities. We at the University of Maryland Medical System, in partnership with Johns Hopkins Health System and Care First, have come together in a way in partnership with the city to try and identify the unique challenges that members of our community face, and how we as healthcare resources can help address those challenges. We are all in this together, and as members of the healthcare community, it is critically important that we deliver a unified message to members of our community that we all have a role to play. And so on behalf of the medical system, I want to say thank you, and we look forward to this partnership as we lean in to the challenge that we are facing together.
Good afternoon. My name is Kevin Sowers. I'm the president of Johns Hopkins Health System. Mr. Mayor, I want to thank you and all city officials that are engaged in making sure that we have the systems in place to support our community as we go through this unprecedented time. Clearly, it is a time in which we need to all come together and develop systems to support our entire community and region as we look at the pandemic and the implications of the spread of the virus in our communities. As Mohan said, it takes each and every one of us to play a role, and I would also like to thank all of the community volunteers that have come forward and all the people who have made contributions to try to support our healthcare workers who are on the front line of trying to take care of the people who need our services. I believe together we will be stronger, and in partnership with the city government, with Care First, and all of the other hospitals within the city, I think we will be better prepared to respond to the coming days. And I want to thank you all for everyone's efforts in doing this. At this point in time, I'll turn the podium over to Bryan Pennock, who is the CEO of Care First. Bryan?
Thank you, Kevin. I think our health system partners covered well the focus from the private sector We at Care First Blue Cross Blue Shield have an incredible vested interest in our local communities. Our associates live and work here. We're committed to doing anything and everything we can in partnership with the state and with the city. We would also appeal to everyone in the community, continue to follow the guidance coming out of our health officials. Stay home, stop the spread, save a life, keep people safe around you, allow for the resources that we can bring to bear in healthcare to be deployed most effectively and to maintain the capacity that we desperately need to ensure the sick and the most vulnerable among us can be cared for through this crisis. We'd like to thank the state for their extraordinary efforts and the mayor and the city of Baltimore for all that they're doing to tear down barriers to ensure the people of the city have what they need in this time of crisis. Thank you.
I want to thank you all for your partnership on this critical, important initiative. I look forward to all Baltimore hospitals joining our efforts. And now Baltimore City Health Commissioner Leticia Zarasa will share updates on our COVID response and some important information and actions for our residents. You want to wipe it down?
Good afternoon. Thank you, Mayor Young, for your leadership, and thanks to my colleagues and our partners at Johns Hopkins Hospital, as well as University of Maryland and Care First for their support in this public-private partnership. We know that this is a challenging time, and we appreciate the efforts of all Baltimore citizens in trying to slow the spread of COVID-19. We would like to share some important information about what you can do today to help protect yourself and others. On Monday, Governor Hogan issued a stay-at-home order for the state of Maryland. This means that no Maryland resident should be leaving their home unless it is for an essential job or for an essential reason, such as getting food or medicine or seeking urgent medical attention. Here's what that means for you. Stay at home and avoid public places, including public transportation. You can still go outside to walk your dog or to exercise, but maintain a distance of at least 6 feet from the nearest person while you are out. Essential businesses and services remain open but must make every effort to scale down operations. You can still go to the grocery store and access other critical services like healthcare. Do not travel outside of Maryland unless it is absolutely necessary. If you must travel outside of Maryland, you need to self-quarantine for 14 days upon your return home. This order is enforceable by state and local law enforcement. If you knowingly and willingly violate the stay-at-home order, you may be subject to 1 year imprisonment, up to 1 year imprisonment, a fine up to $5,000, or both. For more information, visit coronavirus.baltimorecity.gov. We know that it can be confusing and scary to try to understand what it means to self-isolate, quarantine, or maintain social distancing. So let's break this down just a little bit further. If you have symptoms related to COVID-19 or are positive for COVID-19, you should self-isolate. This means staying in a sick room by yourself if possible. Tell others that you live with that they too should isolate themselves as much as possible. Try to use separate bathrooms from others within your home who may be well, and avoid sharing personal items. Place particular focus on cleaning high-touch surfaces daily. Do not leave your house unless it is for medical care. If you have been in contact with somebody who may be COVID positive or who may just have COVID and have the symptoms, you should place yourself in quarantine, even if you yourself don't have symptoms. Stay at home for 14 days from your last time of being in contact with that person. Maintain a distance of 6 feet from others while at home. Ask that others in your household place themselves on quarantine as well. Even if you do not feel sick or don't think you've had contact with anyone who is, you should still maintain the social distancing. This means limiting contact with others by staying at least 6 feet apart. Please continue the personal protective measures, including frequently washing your hands with soap and water for at least 20 seconds or using an alcohol-based hand sanitizer. If you have symptoms of COVID-19 like fever greater than 100.4, cough or shortness of breath, please isolate yourself at home and call your primary care provider or an urgent care centers if your symptoms immediately worsen. Thank you, and I'll now turn it over to Chief Ford.
Good afternoon. Thank you, Mayor Young, for your leadership, and thank you, Dr. Jaraza, for your leadership in this response to COVID-19. As an agency, we remain focused on the well-being of both our members and the community we serve. On a daily basis, we continue to take progressive steps in helping everyone remain safe. As we make our way through COVID-19, this includes continuously sending safety messages to our members about wearing full PPE when it involves patient contact, cleaning and disinfecting apparatuses, encouraging members to remain home when they do not feel well, in self-isolation if they feel sick, and to continue practicing social distancing as much as possible. I also want to point out how relevant and how important it is to let the community know that 911 is specific for emergencies. 911 should specifically be used for emergencies. We're very concerned that we can overwhelm our system just through the 911 system. As first responders, we are not immune to COVID-19. However, we will continue to do our due diligence to continue protecting the community. And it begins with you by following the stay-at-home executive order issued by Governor Hogan, as we all help decrease the spread of COVID-19 within the city of Baltimore.
Thank you to our Health Commission and all our hardworking staff at the Health Department who have been working overtime to safeguard the residents of Baltimore. Earlier today, I visited Pimlico to view the site where the Maryland National Guard is partnering with us to build a community-based center where we can provide testing when it becomes available and other health resources. I want to sincerely thank Belinda Stronach and the Stronach family, the owners of Pimlico, for offering the use of this historic property for this critical need. And if I can stress once again for our citizens to really take into consideration and seriously think about social distancing. When I ride throughout the city, I see people on bus stops and they all cluttered together. I see people who are on the corners doing their illegal activities, all hunched up together. We must take social distancing seriously. And I'm asking and pleading so that we don't spread this to our loved ones as we go back home or into other places that we visit. It's very important that we slow the curve. We have all our healthcare providers that's on board to make sure that we safeguard our citizens throughout the city of Baltimore. So again, social distancing is a requirement. Staying at home is a requirement unless you're going out for essential things such as going to your pharmacy, going to the grocery store, or visiting a healthcare facility. If you don't have to come out, stay home. We'll take a few questions.
Could we ask the hospital executive?
You sure can? Which one? Well, one at a time.
Okay.
Dr. Mohan.
We've certainly seen some nightmare stories about the demand on hospital care, New York in particular, some other places. How would you describe the demand on hospital services in the University of Maryland system at this moment?
Yeah, so at this moment across our system, when I look across the University of Maryland medical system, we are currently able to meet the demand as it's defined today. But I think I speak for the entire hospital industry as we recognize that we have an impending surge that is going to come. That is where the anxiety comes in regarding the ability to continue to protect our workforce and provide the critical healthcare resources that our patients and community needs. When we look at cities like New York, that is why we are doing our level best right now to do all of the appropriate planning for scenarios and to also communicate the importance of social distancing to help bend that curve as much as possible.
When do you all expect the surge to arrive?
So I think we all are dependent on models, and I think again the models that we have looked at continue to demonstrate that anywhere from a few weeks to a month from now we expect the peak of that surge. So the surge can begin. And we may actually be starting to see examples of that right now. But we really focus not on where we are today, but how we plan for what is coming.
Mr. Sowers, can we ask you a question on behalf of Hopkins? There's also been an awful lot said about the lack of equipment, ventilators, protective gear. How would you describe that throughout the Johns Hopkins system at this moment?
So at Johns Hopkins, we have prepared a surge plan to care for all of our communities. And so we have a phased approach. And a part of that approach is looking at our current inventory of ventilators and what might be required in the future. As Mohan spoke to, Mohan and I have partnered together to make sure that we have enough equipment to care for what we believe will be the surge if we're able to bend the curve. But if we are not able to bend the curve and follow the recommendations that's coming out from the governor's office, that's coming out from Mayor Young, clearly we will face issues of scarcity of resources around particular pieces of equipment like ventilators. I would also encourage people at this point in time to sign up to give blood, because there is also a national blood shortage that could lead to an issue of scarcity of resources. And so that's another way that I think our communities can help. But as of right now, I feel that we have prepared for the worst case scenario, and our staff stand ready. And I can't thank enough all of the healthcare workers, all of our fire department, our paramedics, our police that are on the front line and really being extraordinary heroes in caring during this pandemic crisis.
How would you, are the hospitals working together in the region in terms of, we need X over here and you've got this over here? Can you describe to us how that works?
So there's a strong collaboration that's occurring amongst the Maryland Hospital Association in trying to understand the resources that each of the hospitals have or may be required, and working in collaboration with the state. The governor and the governor's staff, Secretary Neal and Deputy Secretary of Health and Human Services, have been incredibly supportive of us in this planning process.
Mr. Mayor, I got a question for you, for the mayor.
Pardon?
I know you put together a good team for the virus, but have you put in, as a mayor, you got to think forward. A lot of folks are being laid off, a lot of businesses are closing. Are you working on any kind of task force to bring everybody back to work?
Well, we're not there yet, but I can tell you this, that we have expended a lot of city resources, city funds, and as you know, we're not collecting any hotel tax, no restaurant tax, no parking fees. We're not collecting a lot of fees. So we're putting together a plan that we're going to look at. I was on the phone earlier today with our county executives from around the state and our federal delegation, letting them know what the needs are for the city of Baltimore in terms of what next steps are. Because if you don't have revenue, you can't pay. So we're looking at all of that, but we haven't come up with no decision yet. We're meeting with our finance team, and we're getting consultation from our federal folk as federal money is flowing in. But I understand that money cannot be used for backfilling salaries, but it can be used for anything that's COVID related, which we have a lot of those expenses. The last thing I want to do in a crisis like this is to lay off people. But if we have to come to that, it's just not going to be Baltimore City. It's going to be all over the country, not just Baltimore City. We're all facing this pandemic.
So your message to the business owners is that you're working on something for them?
For the business owners, the federal government through the CARE Act have a lot of information on what they can get in terms of grants and some loans, but mostly forgivable grants that they can apply for, and they can keep their employees on, and they can take advantage of tax credits in lieu of laying people off. So I only can hear one person at a time. Well, you just heard Dr. Mohan, you just heard Kevin Sowers talk about how we're collaborating to make sure that we're ready for the surge. I can't tell you anything different than that. Absolutely. Or
Hi there. So this public-private partnership actually has 7 work streams that it's focused on. One is a call center. The second one is around communications and how we're messaging to the public. Additionally, we're working on testing. Mayor Young mentioned the Pimlico site. So again, that's a joint effort of this public-private partnership. Additionally, we're looking at 2 data work streams. So one is around, as Jane mentioned, making sure that we have a broad understanding of what the resources are across all of our hospitals in this region, so that if there's an event of a shortage, that we know that another hospital is able to step in and fill that need. We're also using that a similar dashboard to do hot spotting. So as our team, the health department, does the contact tracing, having a clear visualization of where around the city there may be hot spots or increased risk for future hot spots. The next work stream is around special populations. So this is specifically our homeless population, as well as our long-term care facilities and our jails and detention centers, and coming together to understand how we can better support them and what their specific needs are. And then lastly, care coordination. So both of the health system CEOs mentioned just that care coordination and that planning. So again, going back to logistics of if there is a surge, how do we transition patients from one level of care to another? So that's what the last work stream focuses on.
In terms of the healthcare resources in Baltimore City, which are vast, what does the worst case scenario look like?
So I think that's why we're all looking at the models, because I think there's different theories depending on who you ask. Again, as the hospital CEOs mentioned, MHA has a model that they're sharing out. The Maryland Department of Health is also looking at modeling. So I think we're coming together to look at that together to plan out for what the worst case scenario could be.
Thank you.